Hello, my name is Pauraic and I'm a senior speech and language therapist in neurosurgery in Beaumont Hospital. My job as a speech and language therapist is to support people who have been diagnosed with a brain tumour and their families through their acute hospital admission. I'd like to talk today about communication because it's something that sits right at the heart of our daily lives. Whether it's asking for a cup of tea, sharing a story with family, or simply saying hello to a neighbour, communication is what keeps us connected. When you're living with a brain tumour, you might notice changes in how easy communication feels. For some people, it can be harder to find the right words. You might know exactly what you want to say, but feel like the word is stuck on the tip of your tongue. For others, the challenge may be speaking clearly so that people can be understood. Or it might be harder to follow fast conversations, especially in groups or noisy environments. These changes can feel frustrating, and sometimes they can affect confidence too. It's important to remember that none of this is your fault. The tumour or its treatment can affect areas of the brain that control speech and language. And while this can be challenging, there are many strategies that can help. One simple but powerful technique is slowing down. Give yourself permission to pause and take your time. You don't need to rush. Often a short pause gives your brain the space it needs to find the right word. And for listeners, it's helpful to know that you may need that extra moment. It sets a shared expectation and reduces pressure. Another tip is to use more than one way of communicating. If a word doesn't come, use a gesture, point, write it down. These aren't second best options. They're creative tools that make communication successful. For those who notice their speech isn't as clear as before, try slowing your pace and exaggerating your sounds a little more than usual. It might feel unusual at first, but it can make a big difference in how well others understand you. I always like to remind families and friends that communication is a two-way street. Loved ones can support by being patient, by giving plenty of time, and by gently checking if they've understood. Something as simple as repeating back a part of a sentence shows that you're listening and makes the speaker feel valued. Finally, I want to acknowledge the emotional side. Communication changes can sometimes lead to people withdrawing or feeling isolated. If you notice this in yourself, please know it's completely normal, but also that there are ways to stay connected. Support groups, therapy, and open conversations with family can help keep this sense of connection alive. Above all, remember that communication is not about perfection, it's about connection. Whether you use words, gestures, writing, or even just a smile, what matters is that you're sharing and being understood. And please remember that you're not alone. Speech and language therapists are here to walk alongside you, helping you find those strategies that suit you and your lifestyle. Together, we can keep those important conversations going. Swallowing is something that many people don't expect to be affected by a brain tumour, but it's actually quite common. Swallowing is something that we do every day, often without thinking, over 1,000 times a day in fact. But it's also a very complex process. It involves your brain, muscles and nerves working in perfect coordination. If any of these are affected by a tumour or its treatment, swallowing can feel different. The food pipe and the windpipe are really near to each other, and when food and drinks accidentally enter the windpipe and possibly the lungs, this is called aspiration. You might notice coughing or choking when you are eating and drinking. Sometimes food feels like it gets stuck, or meals take longer and require more effort. Some people find they lose interest in food simply because eating meals is less enjoyable. I want to reassure you that there are ways to manage these changes and keep swallowing as safe and comfortable as possible. A key strategy is positioning. Make sure you're sitting fully upright when eating or drinking, and try to stay upright for at least a half an hour afterwards. This reduces the chance for food and drinks going down the wrong way. Another simple tip is to take smaller bites and sips of drinks, and to pace yourself. It's tempting to rush when you're tired or hungry, but slowing down gives your muscles more time to coordinate each swallow. Some people also find it useful to avoid distractions like TV or conversation while they're eating, so that they can fully focus on the task. Food texture can make a big difference too. Soft, moist foods are often easier and safer to swallow than dry, crumbly or tough foods. For drinks, sometimes simple strategies such as small sips can help. If you've noticed a particular problem, food or drinks, it's worth mentioning them to your speech and language therapist, who can give tailored advice and advise if further assessment is needed. Most importantly, please tell your healthcare team if you are coughing or choking regularly, or if you've had chest infections, or if you're losing weight without trying. These can be signs that extra support is needed. But swallowing isn't just about safety. It's also about quality of life. Eating and drinking are social activities. They're about enjoying food and sharing moments with others. When swallowing becomes difficult, people sometimes avoid eating in company, and this can lead to feeling isolated. I want to encourage you to keep those social connections where possible. Even if meals need to be adapted, the enjoyment of sharing food with loved ones can still be preserved. And remember, you don't need to manage this alone. Speech and language therapists can work with you and find strategies that suit your individual needs. Our goal is not only to keep you safe, but also to help you continue to enjoy food and drink, and the social and emotional connections that come with it. Living with a brain tumour brings many challenges, but with the right support, swallowing doesn't have to take away the joy of eating or comfort of sharing a meal. For more resources and to find out more, please follow the links attached to this video.